our webinar being When Being Supportive Becomes Too Much, Setting Boundaries with Clients. Um, I'm happy to introduce Don Morrison. He graduated from UNC Charlotte in 2004, and he has built a career that spanned multiple levels of care. He's been in school-based therapy, in inpatient and outpatient, and clinical supervision. He served as inpatient social worker, and he now practices in private practice, where he continues to work directly with clients while mentoring the next generation of clinicians. He was also an adjunct faculty member at the UNC Charlotte School of Social Work, and he serves as the clinical supervisor to LCSW Associates. And I will tell you, in addition to his clinical work and all his academic work, he is a frequent presenter at regional mental health conferences and seminars. And why we love Don so much is because he brings this practical, real world insight to really complex clinical topics. So he's going to guide us through one of the challenges that a lot of folks face is how to remain compassionate and supportive without overextending yourselves and kind
Mhm.
of blurring those professional boundaries and unintentionally kind of reinforcing some unhealthy dynamics. So, because as clinicians, you're trained to give, to hold, to contain, but sustainable practice requires that clarity and boundary that protects both you and the clinician. So please join me in giving a really warm welcome to Don Morrison today. Thank you so much for being here, Don.
Yes, indeed. Thank you, October. That was such a warm welcome. I really appreciate that. I literally need to make you my PR person. That was fantastic. No doubt. Thank you so much. Please. I hope everyone's doing well today. I have done some of these webinars before, and definitely love to keep things interactive and exploring, like October was saying, exploring very complex clinical issues with very through the lens of very real world clinical practice. So we're definitely going to talk about some boundaries today. I don't know any clinician in any discipline that has ever not had any challenges with boundaries. And so certainly I want to hear your feedback about what you think boundaries are. So please, I think I do this almost every webinar I do. We're going to do some old school Freudian free association. And when I say the word boundaries, what is the absolute very first thing that pops into your mind? And please, use the chat function and give us some feedback. We'd love to hear from you about what your thoughts about boundaries are. The very first thing that pops into your brain. But today we've got learning objectives. October, can we go to the next slide? And our learning objectives today, we're going to look at some signs of boundary drift. As we say, we could probably, if we're looking at that through a Salvador Minuchin structural family therapy lens, Minuchin talked a lot about diffuse boundaries, boundaries that are weak, boundaries that are not very strong. And so we're definitely going to spend some time talking about that piece. And I'm seeing you guys tell me boundaries are necessary, considerate. Walls, absolutely. Linda says survival, totally agree. And in this field, definitely boundaries are very necessary for us to be successful, not just with our clients, but taking good care of ourselves. And let's see, what else have we got here? Renee says they are required. Absolutely agree. And Jacqueline said, when I have clients test my boundaries as it relates to attachment and safety for them, yes, your clients are absolutely going to test your boundaries. We're going to talk about some of those specific examples today too. Absolutely, we're going to apply ethical boundary frameworks. We'll talk about some specific examples there, using scripts even that preserve alliance with your client. Therapeutic alliance with your client is absolutely of the utmost importance. And I think some of the concerns with us setting boundaries uh, are that we might hurt our clients' feelings, or we might make them angry, or we might damage the therapeutic alliance in some way. So we're definitely going to speak to some of that. And also from a documentation standpoint, we've got to make sure that we're documenting our own boundaries very defensively too in the clinical documentation. So October is going to spend some time at the end of our presentation talking about how ICANotes can help with that, and she'll speak more in detail about that later on. And next slide, please. Now, boundaries, I think, certainly feel very difficult now. And I think that they're There's a lot of reasons for that. I think that, certainly, I don't know if y'all agree with me on this, but I feel like in this 21st century social media saturated world that we live in, I think that we are always accessible. And I'm trying not to use absolutist terms like always, but I do think in this case we are always accessible. We get email notifications, we get social media notifications, we get texts from clients, calls from clients, I mean emails, et cetera, et cetera, et cetera. And so those are the things that can be quite overwhelming for us as clinicians, quite obviously. And I think that when we're looking at things like clinician shortages and burnout, I think that is some of the contributing factors with this is that, if you or your practice doesn't have enough clinicians to take care of the number of clients, obviously that's a problem. But also, too, I think a huge part of the problem is that in not setting very firm, consistent boundaries with your clients, that can lead to burnout for you as the therapist. And I'm definitely going to encourage all of you today to focus on taking good care of you, which we'll speak to that in just a minute too. So I've already mentioned this fear of harming the therapeutic alliance. That is absolutely a valid concern, but I think that also, as you all have said earlier, boundaries are very necessary. They are, in my opinion, they're non-negotiable, and we've got to really look at how we're going to establish those with our clients in very effective ways. Um, crisis with crisis inflation too. I think a lot of times, in terms of crisis management, it can be very easy for us as clinicians to fall into that trap of always feeling like we have to always be there for our clients 24/7. And that is a concern we're going to address later on in our chat today too, because I am absolutely not saying to not be there and to not be supportive for your clients, but you also have to take a good care of yourself and be supportive to you as well. Telehealth too, I love it, love it, love it. It's amazing. It's convenient. It's all so many good things, but also too there could be some boundaries concerns with this too, especially as we were just saying, when folks feel like they have carte blanche access to us, that could be very overwhelming and can definitely blur some of the very necessary boundaries that we have to have here. And then we're going to take a deeper dive into these things moving forward. So the digital landscape, I'd love to hear some of your feedback about this, how you feel like you have managed this for your own practice. I think again, it's absolutely amazing what we're able to do now, but also too, it can be a little much. When we're talking about, the clients being able to text us from your session Zoom link, for example, like if you send a Zoom link or a Google link or a Google Meet link or whatever, it's like it does give your client access to you, and it does create some expectations, I think, for you to always be available immediately through any portal response, whatever portal you're using. And I think it's fair to say we can incorporate this in our discussions about the use of texts too, because again, texts help to make us more accessible. But also, I think just as with anything else, too much of anything can be a problem. And so we have to strike some kind of balance with this too. And I think certainly, obviously, I am chatting with everyone here today from my home. And so, depending on your comfort level, we have to be aware of, if you're going to present, if you're going to have sessions with your clients from your home, do you want to use, most of the platforms have backgrounds that you can use where, folks won't see many details about your home space and those kind of things. And so, obviously, I feel very comfortable with all of y'all today. But it's you can use those tips and tricks on the different platforms to have the backgrounds that I think could give you an extra level of comfort there when it comes to boundaries. Um, I think screen fatigue, that is a very valid concern now too. I think that, too much of anything can be a problem. Screens, too much screens obviously can have an impact, not just on our clients, but on ourselves. I think too, speaking from personal experience with with doom scrolling, does anyone else doom scroll? It's sometimes we do have to be mindful that we've got to set boundaries with ourselves and turning those things off, or at least reducing our exposure to those kind of things, which we'll speak more to that in just a second, too. So, if we're being proactive with some of the solutions here with this, I highly encourage everyone to include in your professional disclosure statement or in your initial intake paperwork. I think either space can be very appropriate here with explaining what are your limitations with the use of digital platforms, and and explaining what the limitations will be too, about what could be some realistic expectations of how you communicate with your clients. I think auto replies certainly, can be helpful in terms of helping folks know, hey, we got your message and we'll get back with you as soon as possible. Those kind of things. But we'll speak more to that in just a second too, with some of the scenarios, because definitely want to give some tips and tricks with that. So definitely hold that thought, and we will explore more about how to be very proactive in terms of these solutions. Clear platform boundaries with any social media stuff. Please, I don't have to tell you all this, but please, 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 please do not snap with your clients. Do not, I'm an older person, so I use Facebook. Y'all don't laugh, but Facebook, hey, but please don't be Facebook friends with your clients. Please, 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 no social media, no following each other on social media. That is absolutely a way to blur the boundaries and for the clients to think that you are friends and not in a therapeutic relationship. One of my favorite sayings that I learned long ago was that, when it comes to boundaries, we can't be friends with our clients, but we can be friendly. And there's a big difference with that. So please, please, don't do any social media related things with your clients.
No.
Do you have any feedback on that, please?
Well, I can give a story because just to let folks know, Don and I have worked together for years.
Yes.
And
Yes.
we were like this, and we were kind of babies in an inpatient setting. That was
Yes.
a
Yep.
long, long time ago. It was over 20 years ago, just to kind of tell our age. But what happened, and again, this was back when Facebook was kind of new, but I just needed to share a story where we're all inpatient, and there was a minor that was on a child and adolescent inpatient unit, and they had created a fake profile of a staff member, and at that particular hospital, the fake profile, and they started friending, and it ended up that that particular patient had basically friend requested and infiltrated the Facebooks of 54 of the staff members in the hospital.
Wow. Yeah.
54
Yeah.
staff members. So be very careful where you accept your friend request too, because people are
Yes.
they're very good at pretending to be other people, and some people just like, "Oh, well, I like a lot of followers, so I just wanna add followers," and just be very, very careful about that. I've also I have a unique position here at ICANotes as the chief, compliance and clinical officer. I get to talk to clinicians all the time, and I get to hear, the stories that don't go so well, and this is not, unfortunately, uncommon. This is
Yes.
not unfortunately uncommon where patients are and clients are infiltrating social media. And sometimes I just spoke with a clinician. This was maybe a month ago, where the client had was somewhat infatuated with their counselor therapist. This happens here in
It
practice,
does.
and
Yes.
they had become friends and were actively communicating with that client, or that client was actively communicating with the therapist's mother, and formed a relationship. So I'd say that again, I wear that compliance hat. I'm always looking for the areas that people probably
Absolutely.
wanna throw that.
Absolutely. Thank you for bringing that up, October. And to piggyback off of that, yes, it is absolutely a it is so important to be mindful of who has access to your information. With any of the platforms, I'm thinking Facebook again. Is you can make your Facebook profile either public or private, or just with your friends that you have approved yourself. So I mean, I would encourage you to look at all the platforms that you're using, and incorporate as much privacy as you can, because absolutely some of your clients, not all, but some of your clients are going to look you up on social media. Some of your clients are going to say inappropriate things, or try to try to have inappropriate relationships with you because, and that's where I think therapy veers from the clinical aspect to the friendship aspect of it. Again, we can't be friends, but we can be friendly. But clear boundaries with this are certainly appropriate. And I don't have to tell you this. I don't have any specific numbers. October, maybe you do, but I am very certain with what I'm about to say that most of the ethical complaints that come from any of the, I'm an LCSW, so I'm a social worker, and I can speak from the NESW, the National Association of Social Workers standpoint, that most of the ethical complaints that comes from from the board is or inappropriate relationships with clients, boundaries issues with clients, whether that's being friends, whether that's communicating through social media, whether that's inappropriate sexual relationships. That does happen too, by the way. You will have clients that, and we always keep it real here on these webinars. If you have not already, you will have clients that will try to pick you up and be sexually inappropriate and those kind of things. And so this is yet another area where we have to be very clear, consistent, and firm when it comes to boundaries, because clearly you don't want to damage your client in any way, emotionally, mentally, but you also don't want to damage yourself or your career because you will lose your license. So let's please be
Mhm.
mindful of those kind of things. October, you're the compliance person. Please tell
Mm,
me if I'm wrong.
no, you're not at all. I would say that one of the things is that there are a lot of complaints that go into the boards that are unfounded, like they're perceived
Yes, that too.
relationships, right?
Yes,
And
yes.
but you're right about that being like one of the top complaints. And I do know statistically, like evidence-based, there was a survey of practicing psychologists, and boundary maintenance problems were the second most frequently reported level. That was after confidentiality issues. So it is
Yes.
not when you say the gravity of that situation, it very much is. Jacqueline, I had Phil say I left. It was I chuckled a little bit. It said, I once had a client tell me she thought we would make a good power couple. I'm sure I can only imagine
See,
what y'all have heard. Absolutely. So I think that kind
absolutely.
of drives it home. Yeah.
Yes, indeed. Yes, indeed. And and if we're talking about, and again, we'll talk more about this in a second, but if we're talking about setting those firm, consistent boundaries, as I call them, that would be the opportunity to just immediately shut that down. Because I've told folks before, I'm like, I am not losing my license over this kind of stuff, and so I want you to think of it through that lens too. Nice compliment. If you wanted to do some kind of feedback, like, hey, I appreciate you saying, nice things or complimentary things. However, no, no, it's a complete sentence, as y'all know. And we'll speak more to that in just a second, too. I think we need to move forward here. Next slide here. So, what clinical boundaries really are, and like y'all said earlier, clearly boundaries help to protect us. They're essential, and they're very self. I like to look at them as self-defined. Like you decide what feels most comfortable for you, but I do think there's got to be at least some kind of baseline that we have to use here to make sure that we have these things consistently in place. There are so many different boundaries. Certainly with physical space, personal space. Can as far how you feel about touch, proxemics are certainly a thing, like proximity, what is comfortable, what's the spacing how much space do you have between your client and you in your office, those kind of things, and certainly privacy, like we were just talking about. So making sure that you've got physical boundaries in place, and certainly, if we're looking at this through this therapeutic container lens, I mean, I think it's therapeutic for our clients. I think it's therapeutic for ourselves because we clearly have some guidelines about how we're going to navigate everything in this therapeutic relationship. There are also boundaries, I think, too, with this wonderful concept. I think we're focusing even more on now. It's time and energy. Like our time and energy are precious, invaluable resources, and they are also not infinite. They are very finite. They are we only have so much of them. And I don't know if we have any Swifties here in the group, but Taylor Swift said this a little while back in a podcast where she was talking about this exact same issue. And she was talking about how she wants everyone to look at their time and their energy as being precious and valuable commodities. And then she said, and not everybody can afford them. And that really spoke to me because you've got to make sure that you're setting your own limits, however you feel comfortable, but making sure that clearly we are following our ethical obligations as clinicians in working with our clients in these type of settings. So, also too, I think it gives us predictability. It gives us routine. It gives us structure. If we've got a clear understanding of what our sessions are going to look like, if we have a clear understanding of what payment is going to look like, if we have an understanding about what cancellation policies look like, we'll speak more to all that in a second too, then it gives us predictability. And also safety wise, we have to be very clear, like, I have to make sure that you as my client are safe, but that I'm also safe as well. And that's making sure that, like, for instance, you're not meeting at your office at 10, 11 o'clock at night or super early in the morning, for example. You want to make sure that you are being mindful of your own safety as well as your clients. And I have said this numerous times over the years. Boundaries are not punishment. They are not a bad thing. Please use this as part of your positive self-talk with yourself too. Please keep saying to yourself, hey, you know what? I have the right to set my boundaries. Boundaries are not mean. Sometimes some of your clients might try to make you feel like that they're mean or that they're inappropriate, but boundaries are not mean. Boundaries absolutely protect us, no doubt. And also too, real quick, I just want to touch base on this as well. We can speak more to this in just a second too. But also the gift giving stuff, the material boundaries that I think we have to set. Our clients frequently want to express their appreciation and their because we're helping them. We're certainly helping them through some very difficult situations in their lives, and they're very grateful. And so many, I don't want to make our clients sound like they're these evil, conniving folks who want to abuse our boundaries, because that's absolutely not the case here. But because so many of them really are genuinely thankful for the work that we do for them and for the results that we're helping them achieve. But I think there also has to be limits with this, obviously. In terms of accepting gifts and definitely don't, please don't accept money from your client, any money outside of your fee schedule. Please don't accept any money from clients or any of those kind of things. I think certainly we can discuss some of the ethical considerations when it comes to gift giving here and some of the scenarios we're going to talk about. But I just wanted to, like, throw that out there, that I think that material boundaries, I think, are very important here, especially when it comes to money and financial things, no doubt. And can we go to the next slide, October? All right, so boundary flexibility versus boundary drift. Now, I would definitely, as always, I think it's so important for us as clinicians to show flexibility with our clients because, but also too, there have to be limits to this. So I think it's we're being intentional with our boundaries here and making sure that we're consistent with these boundaries. I think that there can be some flexibility with things like, for example, if someone forgets our session and it's not a pattern, and I don't charge that client that one time for cancellation, for a late cancellation fee. Those kind of things I think are very appropriate. But I always like to say that I know real life happens with all of us, but real life can't happen every single time we're supposed to have a session scheduled. So, please be mindful of that too, and trying to strike some kind of balance with this. Because October said this a little bit ago too at the beginning of our chat, that when it comes to uh, setting boundaries, we don't want to have those diffuse boundaries that I was just talking about consistently, because, that's where the clients will sometimes try to take advantage, or that's where clients it will actually reinforce these negative behaviors. And so definitely we want to make sure we try to be as therapeutic as we possibly can, and consistent as we possibly can. And again, we're going to speak more of this in a second, but making sure we're documenting it clearly and consistently as well. October, do you have any feedback on that?
No, I think you made some really good points. What I would say is, like, there definitely, as far as therapeutic versus risky. Like if let's say a client is in your office and they are actively suicidal and you're and that's at minute 50 in the session, right? You find that out
Yes.
and you extend that session just so you can complete a safety plan. I think and you're that's therapeutic, right? You're documenting like your clinical reasoning, this is our safety justification. Um, but I think there's also like, there's self-disclosure. A lot of people would if a client's struggling with shame and they hear like, well, many people in recovery relapse, at some
Mhm,
point.
mhm.
I'm dealing with patients or clients that do that. You disclose kind of normalizing data, not personal trauma stories. That's intentional. That is therapeutic, right? That's for the client's benefit. So you have those, but then you have these kind of risk boundaries where you drift into those where you extend sessions for favorite clients. People do that, right? Or
Yes. Yep.
you do excessive self-disclosure, like maybe you share a divorce story because the client's going through one, and the client starts supporting you, right? So that's
Mhm.
that role reversal creeping in. Um,
Yes.
but you
Yes.
touched on, like, extra sessions, especially some I've heard a lot of clinicians I've heard this where they see someone and they give free extra sessions to help them out, and they're
Yes.
not documenting financial hardship, they're not updating their policies to
Yes.
match that, so that
Sure.
creates inconsistency, and that's where that ethical vulnerability pops in because people will say, "Well, she was just seeing me free," and then you
Yes.
can't prove to the board that you don't do that across your customer client base, not customer.
Absolutely,
Yeah.
absolutely, and to piggyback off of that, October, I think certainly and I've been in that kind of situation too, as a social worker, I wanna try to help support my clients and be mindful of the different systems that they interact with that are challenging, and the financial
Mhm.
piece is absolutely challenging, especially today. And so, I have to be very mindful of that, but also too, like we said at the beginning of our chat, you've got to take care of your clients, absolutely, but you also have to take care of yourself. And
Uh-huh.
and I know, gosh, oh, maybe we can have a webinar on this October, but I know for a fact that clinicians um have a difficult time talking about money. I saw in some of the comments a little bit ago, folks saying that no was a very difficult word to say, totally valid. But I also think that we have a difficult time talking about money. And yes, there can be some flexibility. Yes, I've seen clients pro bono before, and I still do, as a matter of fact. And I think it's necessary. We should do some of that, but there has to be some moderation too, because what happens what happens is, like October was saying, if the word gets out, and I work in I'm in the Lake Norman area in Mooresville, North Carolina, and if the word gets out in a very small community that, oh, everybody, hey, Don sees people for free. Guess what? Guess who's gonna get inundated with requests for pro bono stuff? So, again, there has to be some balance with this because, yes, we gotta take care of our clients, but we also have to take care of ourselves. And, and money, our money is an important part of that, and we really have to be mindful of that, no doubt.
Yeah, absolutely. Well, no, and Jacqueline, I wanna go back with what you said. When I was I wanna clarify. What I was saying is there is therapeutic boundary flexibility, like, if you
Mm,
say that self-disclosure with purpose, I think that's like many people, have,
mm,
in recovery relapse once, and
mhm,
you just discuss, like, this is normalized data. You're not doing personal trauma stories or anything that if you do it brief and intentional and you do it for the client benefit,
mhm.
absolutely, that's therapeutic. It's
Yep,
when you are doing that risk boundary joke, when you're kind of, like, excessively self-disclosing, and that role reversal creeps in, that
sure.
is when it gets problematic. So,
I
absolutely.
I I absolutely agree with that, and to piggyback off of that, I mean, I think obviously use of self, I think is important. I think it's just like with anything else that we're talking about today. It's you got to use it in moderation. Use it sparingly, but I think use of self is so important in terms of helping us really develop that therapeutic alliance that we were just talking about. Use of self, I think, helps our clients feel like, we're not analyzing them under some microscope, and that we're actually real life living, breathing human beings too. So I really do think that it can help, enhance the therapeutic relationship. But, I think how many times over the years of me doing this have I heard from clients who have seen other therapists where they said, and this is almost a verbatim quote, where they said, "Hey, I felt like I was being the therapist for my therapist." And so, where I think it becomes very difficult, because we should not be overly reliant on our clients for any kind of emotional support. But, still at the same token, I don't think there's anything wrong with using use of self sparingly. I've known many clinicians over the years who have shared stories of their own struggles with addiction and with depression and anxiety, and you know, some of that's been so helpful in helping clients recognize that obviously they're not alone, and that most of the response from the clients was, "Oh, okay, well, if you can recover, if you can do well enough to get the degree and to do this kind of work successfully, then you know what, I can too." So I think Jacqueline was saying some of that too, if I'm remembering some of the comments earlier, where
Yeah,
it's like, some use
absolutely.
of self really helps. I think Jacqueline, tell me if I'm wrong, but Jacqueline, I think you said something to the fact that, hey, I didn't always wear this badge,
Oh,
and it's
Justin
true.
did. Justin said,
I'm
I
sorry,
like that.
Justin. We'll give credit where credit's due, Justin. Yeah, thank you. I didn't always wear this badge. I didn't always sit in this chair. And like sometimes, some of us could be on the other side of the chair or on the couch. So I mean, and that's okay. I mean, because I think some of that stuff is very appropriate to share, but just use it sparingly, because again, you don't want to make the sessions about yourself.
Mhm.
Thank you, Jacqueline. Thank you. It was definitely just Jeff to gets the credit here, no doubt, no doubt. All right, and I think now we got a live poll. I love getting feedback from everybody. Please, we've mentioned a lot of these things already. Which boundary issues do you feel like you face more often? After hours messaging, like we were just talking about, texts, emails, like with like online portals, crisis versus non-crisis demands, session time overages. I think that October was just mentioning those. I was talking about, fee negotiations and payment exceptions, telehealth specific boundaries, being mindful too, by the way. I don't think I mentioned this earlier, but when we are doing telehealth with our clients, we have to always make sure we are aware of who else is in the house. Does this client have privacy? Who else is there? And making sure that, there is, like we were saying earlier with privacy and confidentiality, making sure that those things are in place. We need to know that information. Dual relationships, social media, absolutely. When we say dual relationships, y'all know what those are. Is like anything that's outside of the expectation of the clinical relationship, trying to be outside friends with your clients, dating your clients, following them on social media, any of those platforms. It is absolutely a temptation to do. I'm speaking from personal experience with this. You're going to really, I hope you feel this way about all your clients, but you're really going to really connect with so many folks, and
Uh-oh. Did we? Is that my internet or his?
He's glitched.
Okay, no problem. Well, he'll be right back. So, what I'll say is I am hearing people in the chat talk about session overages and how that happens. And listen, a lot of people are like, "Oh, it's poor time management on my part." It is not poor time management on your part, right? This is the thing. It's about having some kind of anxiety, or some people have rescue energy, and that's a wonderful thing, right? And so this just happens because you don't want to come across like you feel like you're appearing uncaring. You don't, if they're at a crisis at the 48-minute mark, that's really, really difficult. I think there are, and I saw someone put that, and I don't know who did that, their name, but they put in the chat that they had a consent that went over boundary issues. I don't know who that was, but I love that. So please put your name back in there. I love that you have a consent that you go over with your client with those boundary issues. Like, sessions are 50 minutes. If we are approaching the end of the time, I will help us pause and continue to the next session unless there is a safety concern. I think that's really something really good to put into a consent, or go over that with the first time that you meet with the client, to kind of give them or give you permission later, right? You're not cutting someone off. You're just honoring the structure of your agreement. I think that's really, really important. Sometimes I know some clinicians are really good about using like at the 40-minute mark, they're like, okay, we have about 10 minutes left. What feels like the most important thing to focus on before we close today? Do you guys have any of those type of verbiage that you say to your clients? Anything that you say to your clients that helps? Because there's a lot of really smart people in here. Because I know quite a few of these names in here. So if there's anything that you use that's really helpful, I think that's great. I think that's great. I also think if you have like a crisis protocol for those 48-minute situations, like if they're in emotional distress, we're going to schedule the next session, safety plan if needed. But if it's an imminent risk, like you extend and document, right? And you can even document that and say like session extended by 12 minutes due to emergent safety concerns, need to complete safety plan, right? Um, that's flexibility. That's not drift. And we said, I like the statement you just use will repeat, like, not live. Sorry. Yeah, no, I got you. I heard you. Absolutely. My question, concerns, or complaints before the net. Yeah, that's a go on, Francis. Do you have any questions, concerns, comments, or complaints? Right? Love it before the next session. And Jacqueline said, I have crisis lines and all my emails and consent. Fantastic. That is great. That is great. So, all
Yes.
right.
I think I'm back. I
You are too.
apologize. Speaking of flexibility, yes, thank you for your patience and flexibility. Like this is, I think, an example of how telehealth stuff and that this happens as well. You're gonna have some glitches. You're gonna have, you just gotta kind of gotta go with the flow, no doubt. No doubt. So sorry for that brief interruption. And I totally agree with October. It's I think certainly just making sure again that you're as consistent with these boundaries as you can. And the consistency that I think is so important, and that you're documenting it as clearly and consistently and as objectively as possible too, which we'll speak on in just a second too. And now, can you guys hear me okay? Am I coming
I can.
through?
Yep.
Okay,
You're sounding
perfect,
great.
perfect. So some of the boundary situations that we were talking about, I think we're going to kind of have to move a little quicker here with
Yeah,
this.
that's great.
I think
We can.
I could obviously chat all day about all of these things, but certainly making we've already talked about a lot of these things with social media, email expectations, text, portal messages outside of session, making sure too that in terms of the gift giving scenarios that we were just talking about, I'd love some feedback from you guys on this too, because inevitably this is going to happen if it hasn't happened already. People are going to want to do nice things for you. And I think you run the risk, I think, alienating them if you say no, but also you don't want them to be overly comfortable with you if you say yes. So it's like, where do we fall? Yeah, within this situation too, and I think certainly we're going to speak a little bit more to the cultural aspect of things here in a second too. But I think speaking of a specific example with this was years ago when I was working in a school-based program, and we did a lot of home visits. I don't know if home visiting is as prevalent today as it used to be 10, 15 years ago even, but I went over to my client's home, and she identified as Italian American. And this is very important to say. And I walked in, smelled like some of the best food I think I've ever smelled in my life. It was absolutely amazing. And she says to me, Mr. Don, you're going to have dinner with us. Sit down. We're going to feed you. And I said, no, 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 no. I cannot. I'm here to see you. We can do our session. We could do all these things. And she absolutely refused to accept that. And I'd love to hear your feedback on this. I eventually decided, yes, I would eat dinner, and with them, because if not, I think it would be very alienating. And if you know anything about the Italian American culture, as with most other cultures, food is appreciation. Food is love, as we say. And so, so I had dinner with them. I mean, and it wasn't a cash sort of thing where they're trying to give me cash or gift cards or any of those kind of things. But I did take the time and being respectful and had dinner. It was actually amazing. And of course it was. And it really, I think, helped to reinforce the therapeutic alliance here. Did I go to dinner every week with her moving forward from that? Absolutely not. But, I think that in that moment, I think therapeutically, that was probably what was the best approach here. October, any feedback on that? What are your thoughts?
No, I think that you handled that really good. I will say with cancellation patterns, just from working, at ICANotes in the EMR space, that I know that some people have different feelings about charging for cancellations. I did work with a clinician the other day, and she had about, I when we were looking at her list, she had about 50 cancellations over like kind of a quarter period of time. She's like, "Oh, I don't normally like to charge for cancellations." And I did
Mhm.
just remind her, like, if you had charged $50 a month, um, or excuse me, a $50 for cancellation, that would have been over $2,500 for the month. So I do understand that as clinicians, you guys are like, "I don't wanna overcharge. I don't wanna do that." But I also, and I'm gonna say this, and I don't know if it's gonna go over well, so but for a lot of people, because I know that sometimes it's hard getting your practice, getting people to come, and a lot of times if you don't have money, there is no mission. No money, no mission. And I
Yes.
hate to say that, but, like, y'all have to eat too, okay? And
Yes.
so think really about those cancellation patterns, and do charge those fees, right?
Sure.
So I
Sure.
I just to say that.
Thank you
Sorry.
for jumping in on that again, because I mean, clearly, I think that is so very important here. I agree. I mean, we have to eat too. Like I said earlier,
Mhm.
I think whatever discipline you are, I think we have a difficult time talking about money, but you've got to make sure that you're looking out for your bottom line as well. And like I said, I show a little bit of flexibility at the beginning. Okay, maybe one or two times real life happens, and okay, and I can definitely waive any kind of late cancellation fees. But like I said, real life cannot happen every single time, and we've got to look out for our own bottom line when it comes to the finances here. Because yeah, certainly, if you're working on your own in private practice, maybe it wouldn't affect you so much if you're working for an organization like a big healthcare organization like October and I used to work for. But maybe that wouldn't affect your bottom line as much, because if you're working as a staff clinician, then you're probably going to get paid regardless. I know there may be exceptions to that, but when you're working in private practice, and when it is just you, and it is totally up to you to how much you're bringing in, and how much you want to make sure you're being firm and consistent with your cancellation policies. No doubt, no doubt. And I think October, we've got some documentation, some more tips here. I mean, what I think you've talked about these some already. What are we looking at here? Do you think?
And the one thing, and I don't wanna I know it's first time, we gotta move forward with slides, but I would say just, your consent forms are your
Mhm.
make and break. I mean, I've just seen that over and over again.
Yes.
Um, and, my background is before I came to ICANotes, I worked as an expert, at a law firm, a very large law firm. We protected hospitals, we protected large practices. And I was in their mental health division reviewing charge. And I do think that your documentation is everything, right? And ICANOS helps you with the documentation, which is fantastic. But your consent forms are your bulletproof armor. I don't
Yes.
think so. Do not go to Etsy and try to get a consent form. Do not chat GPT a consent form. A
Yes, please.
scan can do it in a couple years, I'm sure, but right now you go and you get consent forms that were created by compliance people for mental health. Not Do not get a generic consent form for, like, a primary care office. That will make you or break you. I cannot say enough good things about that. So
Absolutely. Absolutely. And Jacqueline, I appreciate the feedback you gave too. I did see this where you said you've never lost a client for charging them for missing an appointment. And that's great. And that's a great point to bring up too, because quite honestly, when have had to charge late cancellation fees for my clients, generally they do understand, and they do understand that me working for myself, I do have to make sure I have my coins coming in too. So yeah, I think many of your clients will be mindful and understanding about those kind of things. No doubt. No doubt. Thank y'all for sharing all this great stuff. It's wonderful. And if we're going to the documentation template, I mean, and you guys, I know you know how to document things, but I think where October's coming from with this is making sure that you are protected. And so what did we say at the beginning of our chat? Boundaries help to protect us. So making sure in boundary related notes, you're using the information that is presented. So, if you have the boundary situation, you have a specific behavior request that might be a boundaries issue, then it's like you as the clinician, of course, what you said, what you did, and why, and the clinical reaction, how the client responded. Not a lot of interpretation where you're trying to, say a lot of subjective things, but I think more objectively, what did the client say? Where the verbs to use, the active verbs here, where client stated that she feels angry because clinicians set a boundary related to the cancellation policy, for example. So, and if there is any potential feedback on from the client on the therapeutic alliance, did this damage the therapeutic alliance in any way? Certainly making sure you're documenting that as well. And for me personally, one of my favorite things to do is to actually, in quotes, use direct quote from our clients. And I would encourage y'all to do that as well if possible, just to incorporate some of those in real time things that the clients are saying. And also, as you know, with the plan, what kind of every note is goal oriented, and we're focusing on planning, right? So planning, how are you going to monitor this? How are you going to adjust to it? What do you need to circle back to it? What kind of systems are you going to put into place to make sure that you're managing any of these potential boundaries related issues? So this is an example here. We try to give a couple of a few specific situations here where this is in October. This is your area, certainly with the audit risk. Please tell me, but I think this is an excellent example here where the client keeps texting me constantly and it's exhausting. Okay, valid. That's absolutely valid for us as clinicians to recognize. Our feelings are always valid. But I'm a Marshall Linehan fan with DBT, as you may know that. But yeah, your feelings are always valid. But I think if we're documenting it clearly, let's just stick with the facts. Just the facts. So here, client contacted via text 7 times between sessions. We reviewed communication boundaries from the treatment agreement. So again, you have a document in place with your initial intake forms, professional disclosure statements, et cetera, et cetera. You have documents in place that you can refer back to. And I think that is so very helpful. And using this kind of language when you are just focusing on the facts and not using a lot of subjective type of language, I think that is so very important in helping to reduce audit risk.
We're going to have a webinar coming up on open notes and what your clients, because your clients can request notes. There's certain scenarios
Sure,
that you
sure.
think topics. So I don't, Katie, do you mind putting that in the chat? I think we have that coming up. So if you're
Mhm.
interested in that, because we talk about a lot of documentation and verbiage and terminology, and then what they can and cannot see.
Sure. Absolutely. Absolutely. So now we're moving forward to when to hold boundaries versus adjusting the boundaries. So uh, holding the boundaries, certainly with safety, safety supersedes everything. Safety, as y'all know, is at the top of the priority list. So if there are any kind of things that could potentially compromise safety, whether it be related to your clients or with yourself, I mean, please, you've got to be mindful of those kind of things. Like we were just talking about with social media, for example. It's so many things we can learn about each other, as y'all know, from social media. So please try to make sure that you are protecting yourselves in whatever way you feel most comfortable, but certainly we've got to be mindful of safety when it comes to setting boundaries. Safety too, in terms of safety planning with our clients, making sure that we're making sure that we're documenting clearly what that safety plan is going to look like, and making sure that we're discussing any potential conflicts that may come up from that. Because I think a while ago we were just mentioning after hours support and other other opportunities to give some kind of after hours support because realistically, we are not available 24/7. And, and I think that, I've given clients, contact information for, the suicide hotline or, thankfully we have a local psychiatric emergency room here in the Morrisville, Charlotte area. And, and so I give people that contact information as well. And having an after hours consultation service, I mean, et cetera, et cetera. There are so many different things that we can focus on in terms of safety. And also too, um, is this potential boundary setting situation, is this driven by convenience or is it actually driven by need? A lot of times I think our clients feel their feelings so intensely that they feel like, this is a crisis that I need to have resolved now. And and I think that while it feels so important and relevant to them in those moments, I think that certainly for us, it's up to us to figure out how we can reasonably accommodate those. Certainly with safety concerns, we have to absolutely make that the top priority. But if it's I need to, if it's, for example, I need to hear an answer from you now. Can you meet with me tomorrow morning at 9 o'clock? It's like that kind of thing. That's important, but it is not an emergency. It's more of a convenience focus than an actual need. Also, too, oh, sorry. Go ahead. October. I was going to say real quick about the pattern suggested tendency or role confusion. This is where with the diffuse boundaries that we spoke about at the beginning of our chat, that I think if people are confused about what they can say or what they do or what your role is or how they can help them, yeah, I think a lot of times clinicians. Um, again, our clients appreciate so much of what we do. I think so often, clients can become dependent on us as as their therapist, and and we don't want to see that happen too. And this is where I think consistent boundaries can be helpful as well, because you know what? We don't want our clients depending on us. We don't want any confusions on what the roles are in this therapeutic relationship. I always tell my clients, like, my whole goal of helping you here is to eventually work myself out of a job, and I want you to feel like, everything that we're working on here is related to you taking ownership of things and you managing and controlling things as you feel appropriate. And that at some point, I'd like to think you don't feel like you need me any longer. And and that I think is one of our therapeutic goals with our clients, is to help them make sure that they're not overly dependent on having their therapist as their go-to whenever they have specific challenges come up. We can go to the next slide too, I think, October. I think too, having a script, just having some things. We wanted to give some very specific things that possibly you could say. And again, you can tailor some of these things to your own style, to, however you communicate with your clients. But, I think, like we were just talking about with some of these scenarios, maybe these can be some helpful tips and tricks if you wanted to have a little bit of a script. Because I think as therapists, I think we all have our things that we fall back on with things that we say. If you've seen me in any of these webinars before, you probably see me say a lot of the same phrases and things like that. And I think we have some of those go-tos for setting boundaries too. So, here for after hours content, hey, starting off with something really positive, kind of like the sandwich method. You start off with something positive, like, hey, I care about your well-being, and our dedicated session time allows me to be most helpful to you. And then you kind of go in with the redirection and say, let's discuss this when we meet on this day. And, I really want to be helpful, and I'm really looking forward to figuring out how to solve these issues. Trying to come up with some solutions, but also making sure that you are firmly redirecting your client and setting those appropriate boundaries. Same thing here with session extensions too. Like, how many times everybody here in this group, I'm confident. I'm confident in this. I'm not confident in many things, but I know this to be true. Your client is literally about to walk out the door. They have their hand on the doorknob, and then there's the doorknob confessional, I think as we call it, where they bring up something very important that we have to discuss. And it's like you can't just leave it, and you have to make sure that you address it. And so making sure you try to come in and try to navigate that, I think, as best as possible, because you know what, I'm sure you've got other clients that are waiting, and that client obviously dropped this very important information here. So it's like just trying to find ways to really ameliorate that. And some of that with session extensions is Helen, yes, the doorknob confessionals, yes. But we need to end on time so I can be fully present for you and for my other clients. Let's prioritize this topic at our next session. Now, if it is safety related, definitely say, as we said, safety supersedes everything. And there have been situations where I've had to be late for other sessions because I've had to address those kind of concerns. But if it's anything else, I would definitely encourage folks for you to say, "Hey, you know what? This sounds very important." Again, the sandwich method: give them something positive at first, something validating at first, and then go in with the redirection. That's the whole meat of the sandwich, right? You got the bread. The first piece of the bread is the, "Hey, I know this is very important to you, and I totally get it." Then you've got the meat of the sandwich, where it's like you go in with the redirection. However, I've got other clients I've got to get to, and then kind of end it with the second piece of bread here, and say, "Hey, look, we can discuss this next time. I'm very much looking forward to revisiting this, and let's figure out what we can do to address this in our next session." I always say, let's put a bookmark in it, and let's revisit this next time. No doubt, no doubt. And so, what do I think we need to get to the next slide here, October? Cultural humility and the boundary setting. Yes, please, as best you can, please try to familiarize yourself and be knowledgeable about your client's cultural background. I think almost every time it feels like I'm talking about culture and how important culture is in terms of who we are as people, in terms of who our clients are, but also in how we navigate our everyday world. And certainly, if and I say this every time, you do know that in DSM-5's text revision, we do have the cultural formulation interview, where we are asking questions as it relates to that client-specific culture and figuring out what are the things that are most important to them, and really being able to discuss those freely with your clients. Like I was just talking about with my client, who is Italian American, and trying to navigate that situation with her, being aware that, as we say, food is love, and being aware of her culture and how important that is. And I remember someone in the comments a while ago, if I'm circling back to that, said that, hey, you can find out a lot about a client's culture from the food that they make, and from how the settings are in the home, and who's there, and the roles of the family, and those kind of things. So, in that case, when I was sitting there having a wonderful Italian dinner with my client, and it was a very enlightening experience. So I think that those are the situations where I think it can be very helpful. But I think otherwise, in terms of setting boundaries with clients related to money, or any other kinds of gifts, let's please set some very firm boundaries that those kind of things are not appropriate, even though you do appreciate it, no doubt. So, as if we're doing some kind of damage control, repairing ruptures, with the clients, the relationship with your client after you set the boundary, certainly using some of that good old Marshall Linehan DDT validation. You're validating that their feelings matter. I'm seeing this, I'm hearing this. I totally hear what you're saying. I totally validate what you're saying. And then reaffirming your stance here. Hey, I'm committed to supporting you, and really looking at how to reframe it in a way. You CBT therapists out there, all about cognitive reframing, how we can reframe this into something that's more constructive, more realistic, not necessarily positive, because positive's great, but I think mostly we're looking at things that are realistic. Like, hey, the structure of our sessions helps me provide you with the best care. Let's refocus and reframe this, and let's focus on the goals that brought you here, and let's focus on getting these goals addressed, no doubt. And I think we can go to the next slide. As you all know, any in any of the disciplines working in mental health today. All disciplines have some type of discussion as it relates to boundary setting. With American Psychiatric Association, American Psychological Association, NASW, National Association of Social Workers. Always being mindful of any boundaries issues, particularly with this specific example with NASW, the conflict of in any conflict of interest we should absolutely avoid, and we should absolutely be mindful of. And again, we're looking out not just for our clients but for ourselves in this regard too, because trust me, you do not want to be before your specific professional board trying to um experiencing difficulties with any boundaries violations or any of that. Trust me, you do not want to go there. So please. And I think too, by the way, I think the NASW chapter, excuse me, I think the North Carolina Social Work Board, I think that they still do have a little bit of a naughty list, if you want to look at it that way, like literally where they put online so and so's license has been suspended or censured or revoked, and this is the reason why. And they put the person's name, the clinician's name out there. And so it is a little bit of public shaming, but it's a lot of public shaming, I think. But I think the point of it is to keep folks from doing these sorts of things and to be mindful with potential boundary situations. October, do you see that with the nursing board? Is that a
Um,
thing?
oh, absolutely.
Okay,
Absolutely.
sure.
I will, yeah. Mm-hmm. Mm-hmm.
Absolutely. So please don't end up on that list. Please, please, please. No
Yeah.
doubt. Real quick, with boundaries burnout here, October, did you want to speak to that?
No, I think you covered this really well. I think
Okay.
that
Okay.
you do. I mean, just from a statistics perspective,
Yes.
that it says that studies have shown that up to 61% of mental health practitioners show signs of burnout. Burnout, if you want to narrow it down just to therapists, that is
Yes.
data is showing that 52% of therapists in a given year have reported burnout, and I think that burnout, it just is highly tied to, boundaries, and because
Yes. Yes.
healthy boundaries, you said it, are a form of self-care, and that
Yes.
reduces if you're self-caring, you're gonna reduce that burnout, and so I think that that's, and unfortunately, this compassion fatigue that we hear a lot about it's a predictable kind of
Mhm.
occupational hazard in
Yes.
therapists and all mental health professionals. And if you are practicing these firm emotional and professional boundaries, I think that's one of the most effective strategies that you can do
Please,
to prevent.
please. I totally agree, and that is so very well said. And I think we've mentioned this earlier in in the chat responses too. Please, please give yourself permission to say no.
Mhm.
Please give yourself permission to say no. I think that I look at saying no. There are three, in my opinion, I think there's three different types of no. There are probably more different types of no, but one of those is the explanatory no, where you say no and you explain the reasons why you're saying no. Okay. But then there's also the rain check no. I think stores still do rain checks, right? If they're out of something, you can get it later at that same sale price. Same thing with our relationships with our clients in terms of setting boundaries. You can use the rain check no, like, hey, no, I can't do that right now, but maybe we can do that next week when we meet, those kind of things. And then, as always, we've said it already. The third type of no, in my opinion, is the direct no. No, no. Like, no is a complete sentence. And so it's sometimes you don't have to explain why you're saying no. When it comes to say inappropriate relationships or inappropriate comments that your clients may say to you, no, we're not doing that. And that's my spiel on no, real quick.
Well, I love it. Love it. All right. So we got, let's see, we've got a couple. These are our key takeaways. I did have a question from Marcy about billing I was gonna answer, or did you see that from Marcy? Wanna make
I
sure I
did
answer.
not. I did not. I missed that, Marcy. What was the question?
She said, "Can I offer my clients the ability to extend their sessions at a prorated rate if they are given a choice at the 10-minute warning if they want an extra 15 or 30 minutes?" they can choose to pay for it out of pocket. And all my clients are insurance paid. I think folks had some opinions on there, like, what it depends on the billing type. I will say that, um, from an insurance I'm talking about from insurance compliance standpoint. Do you have an opinion on this, Don?
I think that clearly, if your client pays out of pocket for the whole thing, is yes, you can absolutely, I think, extend the session more easily. That I mean, if they're paying out of pocket, you can, yeah, and within
Mhm,
certain
mhm.
realistic expectations, you can definitely set the fee schedule as you feel appropriate. I think that speaking from and I love your feedback on this, October. Speaking from personal experience and navigating all the
Mhm.
difficulties with our wonderful friends in the insurance with insurance companies. Um, yeah, that will make that more difficult.
Yeah.
I think that insurance doesn't show a lot of flexibility when it comes to these kind of things, as far as them paying for extra stuff or
Yeah.
whatever. Is that what you were gonna get to, October?
They can, well, they might call it, because, in the real is that insurance will do whatever they can not to pay you. And so
Oh,
they could
without a
say
doubt.
it's improper balance, billing, or they could say it's
Yes.
unbundling. It depends on your contract, it depends on the state rules.
Yes.
Um, and so I think that for insured sessions, if you don't prorate extra minutes as a separate private charge for that same psychotherapy encounter unless you have, like, explicit maybe payer permissions. It depends on their policy, things like that. Now, listen, the cleanest insurance compliant option is not prorating. It's just going ahead and billing that correct code. Like, just add on that additional time, put on those, prolonged service codes if you're able to, but the
Sure.
problem is coverage varies wildly, right?
Yeah,
So
absolutely. You
I
can include a crisis code if it
yeah.
is indeed a crisis, and that would be an additional reimbursement. Yes, but I mean, I think that I love what you said, October. We always keep it real in these webinars, and yes, insurance companies will do everything they can do to not pay you, and they may request clinical documentation and supporting your decision to try to do a crisis code or try and add on a crisis code, for example. Be prepared for navigating, those kind of specific situations.
And if you have someone that's constantly abusing your time, you can always come in and say, "Look, I wanna keep our sessions consistent. I wanna keep them predictable. Let's
Yep.
schedule a longer section next time so we can do it more thoughtfully and just keep them on board a longer."
Absolutely. Absolutely. And to piggyback off of what October just said, also, one of my favorite quote that I found on boundaries. I'm not even quite sure who said it, but I found this quote here where, and I want you guys to be very mindful of this as you are navigating your own clients in your own practice. Um, the only people who get upset about you setting boundaries are the ones who were benefiting from you having none. So let's please put that into practice. Please give yourself permission to set boundaries with folks as you feel necessary and within the clinical and ethical guidelines. And let's please keep up all the great work that y'all are doing out there. I really appreciate that you're out there taking care of our clients. And as I say, saving the world. Keep saving the world. And I appreciate you guys hanging out with us today, no doubt.
I do, I do. Thank y'all. And Don, you
Thank you.
were as always, you're
Yep.
absolutely phenomenal. So thank
You're
you for your
absolutely
time
phenomenal.
today.
Stop it. Stop it.
Mhm.
Except for my internet disaster here. So thank you all for your flexibility too. And I hope to see you all.
Absolutely. I am gonna do a quick demo. I know we're over time. I'm
Oh,
so
yes.
sorry, but
Yes.
I just want to show
Absolutely.
you ICANotes. Plus, this is ICANotes Plus. I'm not sure how many of you are using the classic program, but this is ICANotes Plus. It is our new EMR. We are migrating our customers over, but as you can see, it's got a great dashboard. It tells you what you have to do, what you have done, and then also, we have our. Let me show this off for a second. On our calendar, we have you can actually quick share your scheduling link. You can allow people to book online, so you can share that on your website. And so that's a really nice feature. I'll just go into some of our charts. iCanotes makes charting very, very easy. So that's one thing that I can go in. We have SOAP notes, we have progress notes. Um, We have couples family therapy notes, case management notes, quick notes. We do have the ASAM. We have lots of different forms and assessments. We have intakes. But one of the things I'll just go through a note really quickly. I can go in and create a note and say, like, my client has anxiety and those symptoms are present, and maybe they have concentration issues and that's worse, and they have fear of dying and that is definitely continuing and worse. I could say that they're having panic attacks and go into explaining the panic attacks, that's the frequency, it's daily, and these are some of the symptoms they have from that. I can go into their behavior and say, you know what, their social behavior, if they've been isolated, their functioning at work is been impaired. I can talk about verbal content, like maybe they're having problems, like let's say in a marriage and at work, and then they're feeling low self-esteem and some anxiety and depression. Then I can go into psychotherapy and talk about what our goal is. Maybe our goal is working on self-esteem and communication skills and coping skills, and interventions are going to be supporting them, encouraging them to vent their feelings. And then I can also go to their mental status exam. If their mental status exam is good, I can just hit on normal and move on with my life. It'll do a customizable mental status exam. If they've done written
Nice.
skills in their portal, it'll pull those over and then you can document those in the note, which is really nice. And one of the things that I see insurance try to claw back all the time, especially Medicaid, there's even like Blue Shield and other insurances that are trying to do that. But the link to treatment plan, if I bring in my treatment plan that I have created, it's very quick to create that. I can select interventions that we're working on here, and then I can link that directly into the treatment plan. And what all insurance wants to know is, and what's the progress? How are they doing on their goals? I'm going to say they're doing really well. If they weren't, you could say, you know, it was worse. There's no apparent progress being met, but I'm going to say this particular client's doing really good. And we are going to continue the current plan because we're seeing some progress. Sometimes you have the best short-term goals in the world, though, and your clients just aren't going to do them. So you could say new short-term goals will be set, or the long-term goal might be deferred, things like that. I link that in. And then, and we do have an ambient scribe. So if you're like, I don't want to do any buttons and I don't want to type, we do have the ambient scribe in here for you. So you can come on and turn that on. It works for telehealth and in-person sessions. And it will basically, listen, and then it does a very, what we call a clinically humble note. It does a clinically humble note. So it really, we're different than other ambient scribes because we really show like what you do to try to help the client. It's, so we do highlight problems. We definitely highlight key symptoms and things like that, but it shows what the clinician's interventions are, on a grand scheme. So people love that ambient scribe, but we also have, a regular note type here. And so I have a beautiful note. It looks like it took me all day. I can electronically sign that. And here's the last thing I'll show you because of your time. And I want to thank you so much for your time today. Is in our communication tab, one thing that I love is in the client portal, I can go in, I can select forms and assessments. Let's say I need them to do a GAD-7. All right. And then I have like I call it packages, like my intake. This is where you're going to put in that consent, those boundaries, right? And I could go ahead and send that to the client just from here. And when they complete it, it will alert me that they've completed it. I'll get the little notification, the ding bell up here. And so it'll let me know. So this is definitely, this is our new EMR. We are migrating our customers over, but people love this EMR. So I just wanted to highlight it and show it. And thank you guys for your time today. I really appreciate you so much, Don, for
Yes,
joining.
October. No
Yeah.
doubt. We're going to do this again soon. I'm very much looking forward to it. No doubt. And thank y'all for having me today.
Yeah, absolutely. Well, y'all have a fantastic day. Thank you for being out there fighting the good.
Fucking a good fight. You know what I always say? Hey, we're keeping hope alive. Thank you so much.